cognitive behavioral therapy, where we are changing the irrational state of mind, where sometimes you have irrational thoughts. So the treatment is structured towards changing that to rational thoughts. Those distorted thoughts are changing that narrative.
So a lot of times, and I have seen this for myself, every time I tell people I'm in therapy, there's this question of, chick is crazy. You know, there's that. So there's this entire sort of stereotype, or like this entire mindset of, if someone is going for therapy, these people, you need to stay away from them because they are walking minefields.
Yeah.
Yeah. So yeah, you know, and can we get to the point where, first of all, therapy does not mean you're crazy. Sometimes you can even be, and I think part of also being mentally healthy is also going for therapy.
Yes.
Even when you do not have any mental issues, it's always nice to just go and talk to someone else, and they help give you perspective.
Yes.
You know, that's even for a perfectly mentally healthy person.
Yeah.
But how do we get to the point where someone can speak freely about them going for therapy, and you're not being looked at as a person who, like, I'm sure, like, you know, when I've seen this, you go on a date and you're asking someone, okay, are you going for therapy? Because I mean, that's a position where we're moving into, where people need to just like get help for that. How do we get to that point?
First of all, we are starting with this platform, so thank you for that.
Thank you for that.
Yeah, so the way we are talking freely and understanding what it means by being mentally healthy.
Yeah.
Because even for me, when I tell people I go for therapy, they're like, you're the psychologist.
You're the therapist.
Why would I go for... But what they don't understand is, even for me, there's some challenges. I need someone to help me unpack what's going on. I can't treat myself. I need to understand, because also me, I've gone through some challenges in life, loss, trauma, and all those, if I don't get treated, I won't be able to help my clients.
Next person.
Yes.
And even yourself.
Yes, I can help myself.
Yeah.
So the conversation and how we are actually breaking it down and showing what it means by being mentally well, what it means by going for therapy, what it means by working. Because I've had, when I was working in a university setting, and students used to come in and they're like, I'm actually coming to see what happens here. Me, I'm not sick. I'm like, okay, we want to have a conversation, come in.
Yeah.
And that's how conversation starts. And
Yes.
at the end of the session, they tell you, I never knew it's supposed to be like this. And I came here not thinking there's something which was going on, but actually you have gotten some light on, you have shed some light on some of the things I need to focus on.
Yes.
So we continue with the conversation. We
Yeah.
speak louder and making it accessible, where we know when I go to this location, I can find someone to help me. We don't making it's a burden. We look at it as an investment in your life. It's an investment.
I
we're
love
investing
that.
in your life.
Yes. So going for therapy and exercising proper ways to like be mentally healthy is an investment on self.
Yes, you're investing in your life.
Totally love that.
So
I love that.
When you change that,
Yeah.
it's no longer a burden.
Okay.
Yeah.
Wow, this conversation is rich, I must say. I've learned so much. I know our audience is also learning so much from all of this. So if you've told us places where we can seek therapy from, I thought came earlier, and I think I got distracted somewhere because we needed to take a short break. So you're saying someone is going through something, and a lot of times we try to distract ourselves. Is it okay for us to be in feelings of when you're low?
Yeah.
Let me give an example. So I experience loss. So I have a partner, and my partner decides to leave. And so I am sad. Of course, a normal feeling, kabisa. But your friends come and they're like, yo, no, twende sherehe, it will help distract you from those feelings. Is it okay if when I have been lefted and I'm feeling this feeling of loss and rejection and not having a person I cared about being in my life anymore, is it okay if I want to be in a space where I'm just alone and going through those emotions? Is that healthy, or do we escape it? What happens?
That's very tricky. Now is the thing. You need space to process, because by escaping is constantly distracting yourself. And that's why even the distraction becomes now, it's the new way of living. You're like, every time the thought of dealing with the loss comes in, is like, hey, wase twende wapi leo? you keep on pushing it back.
I'm going to have to rebound. I look for another guy to help me get over the other one.
Yes, and that rebound becomes, you've not dealt with this
the loss.
The loss. You go find another one. And this one, you transfer all that to this person, and the cycle continues. So in terms of processing is, it's that place you've said, if for you being in your safe place, it's being alone, it's how you process, no problem. If for you being with others is how you process, identify which is your safe place to process. There's no one way.
So tusioge turudi soko.
Turudi soko.
To the section ya vitunguu ama avocado. No, like we're not showering and going back into the market. Like we need to sit in our sorrow and marinate in it, and let the entire bad feeling embrace us, engrave us, and cry if we need to, until we are over it.
It's called sit with that emotion. How does it make you feel when you're sitting? How that hurt, what does it define? When you're crying, what do those tears mean? What this person, what they meant to your life? And then from there, you accept, okay, this is a breakup. What next for me? And I'm being sad right now. It is okay to be sad. It is okay to feel what I'm feeling. So slowly you're telling your mind, I am okay. Even though I'm going through a heartbreak, we are safe.
Yes.
You're slowly calming down your brain, telling it, we are safe. Yes, it's a heartbreak, it's a loss. And with time, I will be able to not even get over it and learn how to live with it.
Yes.
As now from there, it gives you space for healing. You don't block it. Gives you space for healing. Gives you space for reaching out to people you can talk to. If for you it's alone and it's with your books, that's okay. Helps you identify, how can I go through this process, and what are some of the ways I can go through. So the problem is, many people here kurudi soko, people don't want to do this.
We're just showering and going back into the market
because it's painful. And sometimes you don't want to accept your role in this breakup. So rudi kwa market, ukirudi kwa market, you'll find someone similar to this or even opposite.
Because again of the repetitive compulsion, we are looking for the same person, and we're not trying to find out what it is subconsciously that is making us attracted to this particular type of person who's just going to end up breaking our hearts again.
That's why even I can say it's, we can term it like serial monogamist, where you're from one relationship, you get to another one, you get to another one, and you're like, you're forever in a relationship, but you don't know how to be alone. Not lonely, you don't know how to be alone. So you don't know yourself without someone.
Without other people.
Yes.
Okay.
So that one even removes the sense of identity when it comes to relationship. So until you sit back, I even tell some people, even some friends, I even tell them, I'm like, kindly just take a break. Know yourself. And then when you know yourself, when you're getting into another relationship, you'll know what you're getting yourself into.
Coming from a point of knowledge.
Yes.
Okay. So we've spoken about culture and its contribution towards the state of mental health right now, and how every time someone is saying they're hearing something, there's the issue of bewitchment. Now there's another one. And guys, this one might ruffle feathers, but we need to honestly talk about it. Religion.
Wow, yeah. Okay, ask right.
I mean, like, I know guys who, like, there's the issue of being told, pray about it. Fast. You're in a violent relationship, you're told vumilia. You are feeling some type of, you're depressed, you're told, take it to the Lord in prayer. What does that mean for the mental situation on the ground, and what do we need to do about it? Because Kenya is hugely a religious country. Please.
That's actually a very big concern, because you find in some way it's like invalidating the issue you're going through. It's invalidating your illness. I'm going through, even like you've said, domestic abuse at home. You're telling me vumilia because the like marriage is what within the, like, how do they say it? Like marriage and religion, something like that.
Yes.
So you find many people staying in marriages which are abusive. Trauma after trauma because of religion, using it as a cover. As you've said, it's disqualified the essence of what am I going through. And now in Kenya, because many people still are not understanding what mental health is, you find they put it in the label of religion. Go pray about it because you don't understand it.
Yes, pray for peace.
Pray for peace. Pray for salvation, because thinking about suicide, this is evil.
Yes.
You have depression, go pray about it. Go see a pastor. Go do this. Like, that is where the problem is. Yes, religion, for me, let's look at spirituality. It's good.
Yes, it gives you a sort of grounding. Yes.
And hope. So even most of the times is, if we're in that, let me understand where it's coming from and how it can play a part in healing. But when you use religion to invalidate the person struggling, now that's where my problem is. Where we use religion as an escape. Because many people use it as an escape.
Yes.
And then someone asks, I was struggling, you told me to go pray for it. But I'm praying and nothing is working. So and you're told something is wrong with you.
You're told you do not have enough faith.
Yes.
You need to have faith that your prayer is going to work.
And now what they're doing is they're shaming you. They're making you feel guilty. And some of these things are what even now contributing to even more, like it becomes even extreme for you to deal with. Because if I'm being shamed for the problem I have, you're making me feel guilty. And that guilt is what now drives me to do other things to cope. So it becomes a center of shaming, of guilt, of making you feel like I can't do anything about it if I'm not praying.
Yes.
So for me, religion, it becomes a source of the problem. That's my concern. And I respect the priest. I respect the spiritual aspect, but not when you're using it as an escape. You're using it not to deal with your problem, but you shield yourself and never deal with the problem.
Which beautifully segues us into the next question, which is, when you have a mental, like you're in this mental space where you need to get therapy, and you decide that now for therapy, you're going to speak to your pastor or the head of women's in your church, as the person who's going to offer you therapy. So you go tell them your problems. Please, who are life coaches, our pastors in the church, you talk to an older person, you're told, go speak to a person who's older than you, they have experience, and therapists, actual professional qualified therapists. Where do we draw the line? How do we identify that? Yeah, this is not a problem for the passee. This is not a problem for the pastor. This is a problem for a professional. This is not a problem for my grandmother. This is a problem. There's a bit of sharing. I mean, speaking to them as a way of just like letting easy, just like unloading your burden. But where do we stop talking to the pastor and start talking to an actual professional?
Very good question. Now, earlier I talked about having a support system. Having the pastors, it's good to have that support system. But now comes in with some of the critical issues you're going through and you feel the need of talking to someone. A therapist, ethically, you're supposed to be maintain confidentiality, which on the case of the pastors you come in, that may not be there.
They lose it as someone.
Yes, it can't become a someone. And you feel your safety, and you shared something in confidence and it's out there.
Yes.
That prevents you from sharing.
Next Sunday unasikia, by the way, let's start with wale watu wakona,
Yes.
Yeah.
So see, that one now invades your privacy and you feel I can never share again. So that stops you from seeking help. That hasn't helped.
Yeah.
So already there's an existing relationship. As therapists, you're trained not to have dual relationship because an existing relationship prevents you from seeing things from an objective side.
That's why this chick refused to cancel me. I wanted her to be my therapist. I feel like we know each other personally. I'm not going to be able to help you. I'll recommend people. She's been recommending people.
And for your own, I can be there now to guide you in the direction to go, but I can't help you because I already know you personally. So even when I'm helping you, it's based on an existing relationship already. So I'll be harming you than helping you. And it's the same thing going on when you go to pastors. You already have an existing relationship with a pastor. And even this pastor is coming from a spiritual aspect. So even some of the issues you may be going through, you feel comfortable.
And he does not understand them either.
Yes.
He does not have a full grasp of exactly what is happening.
Yes.
And that is why we have people going to study for years to be able to offer us this therapy.
Thank you. So the pastor won't be of help. But the problem is, the pastor, he or she, it's for guiding. And some of maybe things you can know, I can talk to them, but not when you're coming to struggling with something. Because when you go, let's say something like even depression, having suicidal ideation, something with substance use, you go talk to a pastor regarding this issue.
They'll condemn you.
Yes, because that's against religion.
Yes.
So that's not going to help. You'll be harming yourself and
even
preventing yourself from seeking help. So the one thing which bites therapists is confidentiality.
Yes.
Whatever we talk about in therapy, we'll never leave that room And if I have to maybe share, I won't share the details. It's maybe I'm going for supervision. I need guidance with a case. The supervisor will never be able to know who is this person.
I want to add something to the confidentiality and also lack of judgment.
Yes,
because you know, like, you really just need to be poker through it. Like, you cannot show like, oh, you're like, oh my God, I truly do.
Exactly. Like, even you're shocked for someone.
You know, you're like, you guys have to like look like, oh yeah, I've had that before. It's nothing out of the ordinary. But like, you go tell your friend, and they're already like, me by the way, me last time, but then kitukayo lini hapenia. We always have this small fix. You know, you go talk to your friend, and then they're giving you, by the way, ata mimi nilienda na kitukayo, and then nilikunywa tu Johnny Walker bottle moja, and then I was good. I was Gucci. We can move on. You know, like, so talking to a therapist means they're able, like, they're not judging you. They're looking at it from an unpersonalized angle. They're not trying to personalize it. And there's also the aspect of confidentiality. You're not going to hear your story with 10 others, you know, tagged on Facebook with 10 others. You know.
And then also in terms of safety.
Yes.
I'm providing a safe place for you to come and be yourself. Allow me to help you unpack what is going on. So a pastor will not give you this. Now comes in the part of the life coaches. What life coaches in terms of maybe when it comes to you want a transition in life, maybe a career change, things which are maybe like in terms of maybe even relationship advice.
Yes.
That's where I say life coaches come. They're not counselors.
They're not counselors.
They're not counselors.
Yeah.
They're not trained to understand what are some of these pathologies you're dealing with. This is be able to connect and say, okay, you've given me, these are the symptoms. What is going on with you? They don't have that capacity of digging deeper and knowing. And if now, what I usually say is, it's so easy for someone to, mental illness is like, let's say it's a wound. You have a wound. And then now you bring these, even the pastors, you're saying they come in, you bring someone who has gone maybe even a short course who say, and they can be able to help you open.
6 weeks.
Yes. I created
on
rapport. Yes. And already you've said, I'm a counselor.
Oh yeah, I mean.
So this is what people don't understand.
Yeah.
When, like as I said, we have like when someone has diabetes, there's that wound they usually get, and sometimes it may heal on the outside and
but inside it's still
yes. So this is what comes to therapy comes in. So when you go talk to someone the first day, it's so easy to open up. They have been taught how to create rapport. That's the first basic counseling skill you're taught. Create rapport, a safe environment for someone to talk. But when you've opened that wound, that person has been functioning by the day before, and they knew how to function, and they could suppress that because they are not ready to handle it.
Yes.
So you come here and we talk and you open up, and you opened old wounds of 20 years or even 10 years before, and now it's fresh again. It's like a fresh wound, and you come, you open it. But do you have the skills to heal that? To
heal it from now inside out.
Instead of covering it, and then after 2 days you're like, oh my God, I feel so good. 1 week later,
it's still terrible. Back to your old.
You inside slowly. So when you go easily and open up, it's okay. But do you have the skills to help this person heal the wound? Not many have. If you haven't gone through training, they don't know how to keep you with skills to treat you slowly and heal. So they cover. They won't continue eating you inside and thinking, oh, I'm good. But the problem is you're still struggling. Because for you to actually heal, you have to go through that emotional, it's uncomfortable. One thing I tell people is therapy can be very uncomfortable because you have to deal with emotions you've suppressed for the longest time.
For years, for like 30 years even.
Yes, and this professional, the therapist, has been trained to work with you in that journey. Even them, they have worked on their own to walk with you through that journey. It may be 1, it may be 6 sessions, it may be even a year, it may be 7, like it depends on the issue you're going through.
Yeah.
So come with the pastor. Is he or she trained to do that? And already you have a dual relationship. That session is out. That is not helping. A life coach, it's maybe a transition, you're going through a challenge. That one they can help. But a life coach, when they discover there's an underlying problem, they are supposed to refer, not deal with the problem.
No, okay. Yes. Okay.
So that's where now the distinction comes in. But many people want to deal with the issues and tell you you're okay.
Yes.
But the thing is, you're leaving me in pain without even knowing. You've opened an emotion as something that's suppressed, but you haven't been able to help me heal.
Okay.
So that becomes the challenge.
And I like that you've said sometimes therapy can take a year, And even 2 years. Or
even longer.
So after how much time do I begin? Because I know like someone will be like, I went and spoke to that therapist 1-2 times, and I think I've told you that.
Yes.
And I didn't feel any change. So at what point, after how long or how much time is enough to go to seek therapy? Is it like, after how long can you say that, okay, this therapy is working or not?
Some people say even after 2 sessions, others say even the first one. Now, this is what happens when it comes to therapy before you end. You need to leave that room having some sense of hope, not thinking now, because it can be emotionally draining.
Yes.
And if you leave that room emotionally drained, meaning what have I provided for you? What have I helped you to actually be able to like become a cushion before the next one? So some people say in Kenya, going for even having a client for 3 sessions plus, that's a plus for us because at least they're committed.
Yeah.
So we are told even you have been trained, you may treat that session as that client may not be coming back again. So you come in, I identify the problem, and at least give you some sense of hope when you're leaving that session. But we know we haven't tackled the problem, but at least I've equipped you with some skills to keep you there. Sometimes even I have clients who come once, disappear for 3 months, come back again, and like back to normal again.
Yes.
I don't judge. You start afresh again. Like, but now keep on insisting the essence of committing.
Yes.
Sometimes even we say like we'll be talking about that. There's some session where we say after 6 sessions, that's how we see change because it progresses. In the first one, I get to know you, I do assessment.
Yes.
Diagnosis comes in, and then treatment plans comes in. And from there, I can equip you with a plan which can take you longer even without me. And the whole essence is, I need you to be independent to cope with these issues. I don't want you to depend on me. I need you to be independent enough. So if you leave this room, I know you can actually be able to take care of yourself for a while. So it can be even 3 sessions sometimes. At 6, minimum, I usually say 6 sessions. It can be even less, but a minimum of 6 sessions, that one is okay.
6 even allows for rapport, for creation of rapport, and then you're able to like begin to scratch the surface, and then begin now to get to the point where. But I also like where you're saying a therapy is supposed to enable someone to like function independently, because I think a lot of times. And so does it get to a point where I stop going for therapy and I don't need it, or once we've done the scratching of the surface and I'm able to function, I can come back every 2 months if I feel the need to, maybe every quarterly if there's a need for that?
Yes.
Okay.
Yeah, so it can be, you say, I'm having a challenge somewhere, you go back, but already you've learned how to cope with it, because the minute I empower you like that, you have skills on how to cope with the daily challenges, even the struggle. And there are others you find adherence is compulsory. Because I know after 2 days, things will not be well. Okay. So it depends with, after assessment, what is needed after that. So it's individual, it's based on the individual. But even after that, you can say sometimes you find after 6 weeks, I tell you now, I want to be becoming monthly. After that, I want to be becoming 2 months.
Every 2 months,
So if you become dependent on my side, now that's also another problem. Yes, I need to know why is this happening.
Yeah. Or maybe I'm falling in love with you.
Now
I want to see every
Now that becomes a challenge of, I realize, is it helping? If it's not helping, refer.
Wait, is there me falling in love and it being helpful?
No, I'm not falling in love now. That one is a problem. That is a problem, yeah.
Okay, so as we wind up, and I think we have like about 2 more questions left. So there's different people who deal with different aspects of the mental. Yeah. So we have psychiatrists, we have psychologists, we have psychosocialists, and all these other many terms. There's so many. Tell us which ones they are, break down. And then we'll come to the last question. Okay,
now when we start with psychiatrists, we know with psychiatrists they prescribe medication.
Okay.
They have been trained as some of them, they go to an extent of even offering therapy, but for them, they are the only ones who can prescribe medication.
And they also have an undergraduate degree in medicine.
Yeah, that's in medicine, and then now they specialize in psychiatry. So that one is coming from the medical aspect. Now comes to the next one, now we have the clinical psychologist, where for us, I can do a diagnosis, I can provide a treatment plan, but I can't prescribe medication.
Okay.
I work with people struggling with mental illness, like the same way with psychiatrists, but now I can't prescribe medication. For me, you can come to me, I do diagnosis, and then if I see a need of now getting medication. The diagnosis, I can now refer to a psychiatrist with the diagnosis, and you get medication. Yes. So that for us, you've been trained to understand all mental illnesses, knowing how to treat the mental illness and the diagnosis. That was even assessment. Now comes to counseling psychologists. We have counselors. For them, they have been trained on mental illness, but not the level of clinical psychologists. For them, they can deal with other behavioral issues. You're going through relationship problems, stress related issues,
marriage counseling.
Yes. Now we have a different set with marriage. People trained on marriage and family therapy. Then they've been trained to understand the systems of marriage. So like for me, you come to me, you're struggling with, you have a family problem or marriage problem, I will refer you to a marriage
counselor, therapist.
But if it's a clinical problem, I can address.
Yes.
But it's now, apart from that, we have others who are trained on dealing with children. They're trained on that. People now the specification. Now we have others who are, as you've said, we have addiction counselors. Addiction counselors are trained to deal with people struggling with addiction, and you find majority of them, they are maybe recovering, and now they're trained to deal with that. So we have now even counselors we have the counseling psychologists, we have the counselors. Yes.
So counselors may not necessarily be psychologists.
No, they're not trained on that aspect. So the counselors, they're the ones, the same way they deal with the basic now, the issues, the daily life issues.
Is that where we put our pastor?
Now
and me?
Yes, where they have been trained basically on, but now it comes to now when they meet someone struggling with a mental illness, they refer. And that's how the system is supposed to be, refer. And then we have others like forensic psychologists who work in the criminal system, dealing with people now within the criminal aspect. They're the ones even present in court, presenting those cases. So we have that.
Okay.
Now, like it's a big field.
It's a big field. It is actually massive.
It's so massive.
Yeah.
Like you remember when I started, I said like I've specialized in sports. Although we have sports psychologists within who understand the issues affecting sports people. Like for me now, I came to train on understanding clinical issues affecting athletes. Yes. Because depression, anxiety, but within athletes.
Okay.
Yes. So it's wide. And then as you've discussed about life coaches, we have others who are in Kenya going for the 6-week
Coursera degree. Or diploma or whatever.
Now, what I say is that one is helping in coping So it's like basic awareness of what counseling is.
Okay.
But for the psychologists, as I've said, like even in Kenya, having from masters and beyond, that's why you've specialized. Because now degree is basically understanding the field. But from masters now, as someone who is specialized and even understands how to treat. Yes.
Okay, fantastic. So what is behavioral cognitive therapy? What is trauma-focused therapy? What are all these therapies that we have around left, right, and center? There are so many. So like, how do we need a full topic to discuss that?
I think we can touch on it.
Just a bit, and then we'll have you, because we want you to keep coming. So we'll create reasons why you should be here every time.
So it's the techniques used within therapy. As I've said, the one way I said having like coming for 6 weeks treatment, usually use that more of CBT. So CBT, it's cognitive behavioral therapy, where we are changing the irrational state of mind, where sometimes you have irrational thoughts. So the treatment is structured towards changing that to rational thoughts. Those distorted thoughts are changing that narrative. We have that one. And that one now with CBT requires a lot of assignment. And so if you go to a therapist trained to be a CBT therapist, you'll have constant assignments because you are doing the work.
You're doing the work.
Yes, you're doing the work. The trauma-focused therapy, where the approach is where I was talking about, I'm working with you with the knowledge of you have undergone trauma. So instead of starting to diagnose so early, let me know what happened to you.
Yes.
So that's a technique we use. We have others who use the one for narrative therapy, where even talk therapy, where you just come and we talk, and from that story I can come up with what's the problem. We have the play therapy, like it's different. It's the different techniques we use within therapy. And every time you go to a therapist, they will tell you, for you, I'll be working on this. because based on the condition you're going through, the illness, the technique for therapy is different. But CBT is so common because everybody else struggling with even a mental illness, the distorted thought process is there.
Yeah.
And it's used to change that narrative. And now that's the work we use. We have even others we call now acceptance commitment therapy, where my work is to help you, like based on the condition. Like let's say even someone struggling with schizophrenia, the technique used is different based on the condition. We have others struggling with bipolar. The technique is different. There are others, the psychoanalysis, where we have always known about hypnosis, and the psychoanalyst uses now going down to your childhood, helping you through that process. The CBT, we are working with the immediately here and now. We have others where it's like they're different.
There's different.
There's so many.
Yes.
I think that one requires now
a full conversation around it. And I think some of them will actually meet as we discuss different things.
Yes.
And then we can also be able to tackle them as we move along.
Yes.
Wow. Okay, so guys, first of all, Rhodah's contacts are just going to be down here because this chick knows a lot of stuff. So if you guys feel like you want to talk to her, you can holler at her and she should be able to assist you or even recommend someone who you can be able to talk to. But I feel like we have taken this conversation quite a bit and we can, but a thought came to mind. I'm sorry, a thought came to mind. There's also psychologists for children because those are pediatric psychologists who just tackle, like who are trained to deal with pediatrics and children and those other issues. I'm just saying, I'm just adding that. That's me adding.
Yeah, those ones are there. Like for them, like even I've had people come to me, like I have a child who is 3 years old and I tell them now for me, I'm not trained. Yes, I understand the assessment that is there, but I know a specialist trained to understand what the child is going through. So every age, like let's say stage in life, adolescence, we have others who are trained to deal, they're called geriatrics, over 60. The older people, they are trained to understand issues affecting older people. And that's their speciality.
I love that.
Yes.
Okay. Last question. Honestly, last one, I promise. So every time I've spoken to someone who's looking for therapy, a lot of times they want to go for therapy to people who are older, like significantly older, because they get the sense that going for therapy from a person who's probably around their age or someone younger, they feel like they wouldn't understand their issues. Tell me about that.
From a personal experience, I faced that a lot.
People rejecting you because because of your age.
Yeah, even sending CV and they tell me send your qualifications. Even parents who are referring their kids, they send me no. At your age, no, you're very young. You don't know stuff. Yeah, you don't know anything. So that's a challenge I've also faced, and many in our profession we have faced, where they're saying, and that it's the same lack of awareness of knowing this person is trained to deliver. Yeah, they know their work. So you even sometimes I tell them, give me, if you're not comfortable with me, that's okay, but you can give me even a chance.
Yes.
And see how
it goes.
Yes.
If you feel like I'm not qualified, that's okay. You can find someone who's maybe within the age bracket that you want.
Yeah.
But in your age, you still can execute your job. It's the same way a 22-year-old doctor who's qualified and has their degree can be able to treat whatever malady anyone has.
Yes.
It's the same way a 26-year-old psychologist, as long as they have the qualifications, will be able to assist you.
Yes, and now that's the people think, let me go to an older person because maybe they have more experience. Yes, the experience
might be there. Yeah.
But now the thing is, as much as the age is there, it's this person has been trained.
Same way.
Yeah, the same way.
Yeah.
They've been trained the same way. And other times I tell, if you're feeling comfortable, that's when you find even older people coming to you and they're telling you, you're young, I don't think you can help me. And even proving to them and trying to tell them I'm qualified becomes a challenge.
Yeah.
So for me, I tell them, if you're feeling not comfortable, let me refer you because I need you to be well.
Yes.
And I need you to be comfortable. Others have gotten to a place where when I refer, they're like, actually, okay, you're mature enough to refer me, so I think you can help me.
We can have this conversation.
Yes.
Yeah.
So others, you just have a conversation. So because for you need to be comfortable, but that notion of you need someone older, or because I need a man, I don't want a woman. So I want you to be in a safe space and comfortable. But before that, I psychoeducate them.
Yes.
If they come to me and they tell me, I thought I'll meet someone older. So then let's have a sit down. I do psychoeducation, and after that, I tell them, "Are you comfortable?"
You
still?
decide.
You
Yeah.
decide.
Yeah.
I have this contact. You can go talk to them because it's your life which matters.
Yes.
But that notion is there. I have faced it a lot, and I'm telling you, I can't change who I am.
I can't change my age.
Yeah, I can't.
But I'm here now.
Yes. So it's constant. It's there.
Yeah.
But all I do is psychoeducate.
Yes.
Let me psychoeducate you what actually therapy means. What it when others they think it's advice, and I tell them, I'm not advising.
I'm not advising you.
I'm guiding you.
Yes.
In this journey.
I like that you've said that, because I think a lot of times the reason why I think there's that whole issue of age is because people think, the older you are, you probably have gone through experiences so much more, and so you can advise. But your job is not to advise. Your job is to guide. Yeah. And that means if you have the prerequisite qualifications, it doesn't matter whether you're 60 or you're 30 or you're 25, you still get to guide this person.
Yes.
Regardless.
Yeah.
Okay.
Yeah.
Well, thank you so much, Rhodah. I think we're just going to do our breakdown, because our conversation has been long, but also very insightful. Oh my God, I feel like I'm starting my practice campus therapy. That has been some very insightful conversation, courtesy of Rhodah, always bringing the wisdom into this entire conversation, which we really, really love. And so to conclude all that, here are a bit of recap, just so we remember what we've had all through. Number one, it's important to safeguard your mental health by doing things that enrich your mind in a positive way. So staying in an environment that is good for your mind, keeping away from toxic stuff, exercising healthy habits like exercising, journaling. She said journaling, writing your thoughts down is very important. Seeking therapy. You do not have to be unwell to seek therapy. Also, relating with people who feed your mind with positive things and consuming positive content. What she also told us is that there are people who can be predisposed to mental health issues, and these are people who are maybe born genetically. There are people predisposed to mental illness, but also the environment contributes a whole lot to us ending up with mental disorders. Some of the common mental disorders include depression, schizophrenia, bipolar disorder, there's anxiety disorder, panic disorder, and all those other things. And when you feel that you need therapy, kindly go to a qualified therapist for help. We love our pastors, we love our religious leaders, we love our family and our friends, but those are not the people who are going to help us through this. We need to go to see professionals to be able to be assisted with this. And it's important for you to find a person that you're comfortable to talk to and be able to follow through so that we are able to feel better at the end of the day. Among many other things, definitions of neural, psychological disorders, and everything else in between. It's a lot. I hope you've watched it. So we'll conclude for this episode. We'll be back again with something else, something sweet, something very educational for you. But for now, we have to leave. I have been your able host, Mogoi Ayenda. Remember, we are all mental, and don't forget to follow us on our social media platforms at Mogoi's Musings Pod on Instagram and on Twitter. Subscribe on our channel, Zigzag channel, here on YouTube. And remember to put on the notifications for the next time we have our episode out. And from me, adios. Bye.